everyone. Thank you so much for joining us today for our special webinar of surrogacy and fertility care, a medical perspective for the IPs. My name is Christina. I am with ACRC Global, and I am an intake manager. So I work very closely with our surrogates. And today we will be speaking with our expert, Dr. Conway, here at Utah Fertility Center. Thank you so much for joining us today.
Thanks for having me.
So this webinar is designed specifically for the intended parents who have questions about where the journey starts and exploring their paths. The topics we'll be covering today is IVF, surrogacy, PGT, and how the clinics work to support our families. We want to be informative, but also feel safe in a welcoming space. We are going to leave time for questions at the end. So before we get into the discussion, I do want to let you know that if today's webinar sparks any questions or you feel you're ready to take the next steps, we'd love to connect with you one-on-one. We do offer complimentary consultations to speak directly with our team to learn more about the surrogacy process, ask any questions about matching, timelines, next steps, and to see if we would be a right fit for your journey. No pressure at all. You're welcome to scan the QR code for our consultation, or you can also find us at acrcglobal.com. And today our guest is Dr. Conway. She is a board-certified specialist in reproductive endocrinology and infertility with a passion for advancing fertility care. Through both science and compassion, we have earned a medical degree through the University of Pittsburgh. She completed her residency with New York University and a fellowship with UCLA. She's received numerous research and teaching awards and is dedicated to guiding patients through every step of their fertility journey. Her expertise includes fertility preservation, LGBTQ+, family building, third-party reproduction, and all aspects of reproductive medicine. We're very honored to have you here today, and thank you so much for taking time with us. Do you want to tell us a little bit about your practice here?
Yeah, I would love to. We're in the middle of I think a lot of people feel nowhere. Although you're here too. So all the important people are here. So yeah, I think a lot of our intended parents are a little surprised that we are here nestled into sort of the side of the mountains and near Salt Lake City in Utah. We have started as, I would say, nugget of a practice about 15 years ago, and it was very boutique and slowly grew over the past 15 years into a really busy fertility clinic now. And I've been in this practice since 2012. And it was so small at that time. And I think at that time really thought there was a windfall opportunity because there's so many young, healthy women that, because of some of the cultural aspects of Utah, are particularly healthy and actually really love donating their eggs. So we started a donor database as part of our practice that has really developed, I think, the third-party practice aspect of our program here that has actually helped a lot to grow and really helped a lot of couples and individuals and intended parents actually not only coast to coast, but even all over the globe at this point.
Oh, that's awesome. I do. I love your guys' clinic here, honestly. It's one of the best ones. I'm not biased just because we're here in Utah. But thank you so much for having us. So we're going to move into our Q&A session with you. So I know that we're going to be talking a little bit about our frequently asked questions for our intended parent side of things. So the first question we have is, what are the first steps that intended parents should take when starting their surrogacy process?
It's a great question, and I think it can be very overwhelming for these, individuals or couples coming into the process because, there's the agency side and the donor side if needed, and a surrogate, and all the clinics and options. But I think, you have to start somewhere. We go to these big meetings all over the world and talk to intended parents in different places, and we kind of joke it's like deer in headlights. I think in the beginning, because it's hard to know, but I think you just have to start somewhere. And for, I think, a lot of intended parents, starting with an agency and, talking to friends and family members that have been through similar journeys, looking online, finding resources, and interviewing usually multiple different agencies to find, an individual at an agency or just an agency that they really trust and feel connected with. And if you find an agency you really trust and feel comfortable with, from there, they will help to guide you through all the different steps of the process. A lot of the agencies can also give you insight into different fertility clinics that have a lot of experience with third-party reproduction. You know, people using egg donors or surrogates is what we refer to as third parties. So, you know, I think just starting with an agency that you feel really comfortable with, moving forward from there, and like kind of getting resources and talking to them, so you're getting your own information, but also letting them help you to guide throughout all those different steps of the process.
Which is great because it can be very overwhelming.
Definitely.
So can you give us a little brief walkthrough of how IVF works within a surrogacy journey?
Sure. I mean, it is actually very similar with any IVF cycle to one that you're going to intend to eventually transfer embryos to a surrogate. There's a little bit more infectious disease testing in the beginning in the preparation process. Because those little microscopic embryos are technically, by the FDA regulations, tissue from certain individuals going to a different person. So, but other than that initial screening, it's actually very similar and involves a few weeks of actually very basic screening, doing an ultrasound if there's a female partner, looking at the ovaries, counting all these little baby eggs in the ovaries that we call follicles. That gives us a good idea of a woman's egg reserve. Which can be really different from one individual to another. With the ultrasound, that helps. And then we also do blood work, checking hormones, and very simple blood work to look at egg reserve, because each IVF cycle is really customized to the individual person going through the process. So with a couple weeks of initial testing, we start planning with the nurse and guiding people through this IVF process that's pretty busy and can feel a little tense for a couple of weeks, but it goes by pretty quickly once you plan it. It's about a 2-week process, and it involves being on a series of hormone injections, which sounds scary, but we kind of help people get through this process.
You warm up to the needles.
I think it's like the anticipation is almost worse than the actual injections themselves. So we really help with people with education. They get through this crazy process, and it tricks a woman's body into growing not just one egg like what would normally happen in a natural cycle, but growing many eggs all at the same time over those 10 days of injections. And then at the very end, they go under actually sedation in the office for about 20 minutes. It's actually probably the best part of the process. You get to go sleep. It's a little nap in the office, and it's a very straightforward procedure where we go in and retrieve the eggs from each ovary. And once we have the eggs out of the body, they get to take a little break, you know, just waiting for their cycle to come, or whatever the situation may be. And then all of the rest of the action, the magic, is actually happening in the lab. Once the eggs are out of the body, we connect the egg and sperm in the lab, grow embryos for 5 to 6 days in the lab, and they'll grow into what's called a blastocyst embryo by that point, that we can either freeze and then see for when they're ready to eventually transfer those embryos back to a gestational carrier. Sometimes we'll be doing additional testing on those embryos, like genetic screening, where we take a few cells from the edge of each of the embryos right before freezing them. And once the embryos are frozen, they're frozen in time, so they can sit in the lab, you know, basically frozen in liquid nitrogen, suspended until anybody's ready to come back and use those embryos down the road.
That's awesome. So kind of like a limited shelf life.
Correct.
With it. That's awesome.
It's really unlimited.
Yeah, really unlimited actually, so long as you keep it in the right conditions.
Correct.
Which is great. Honestly, it's kind of nice that you get to grow them and then they just get to stay there till you're ready, or if you do multiple rounds, you don't have that option for multiple children to have them, where you've gone through the hormones once, not necessarily needing to do it more than once, which is, not gonna lie, kind of nice.
It is really nice. And that's where that initial testing is really helpful. So we really want to make sure everybody, before they're actually going into the IVF process, has good realistic expectations of how they're going to respond to the medication, how many embryos, at least within a reasonable range, they may expect to have, and then going over like, okay, for each of these embryos, what's the potential as far as pregnancy rates? And yeah, it's an amazing technology. And we kind of joke that our embryologists are like embryo babysitters, because they can just be staying there until they're ready to be used down the road.
Those are so magical, I'm not gonna lie. So what are the typical timelines for the fertility process leading up to transfer? Actually, we covered that. It's about that 2 weeks. Oh, well, up until transfer. So once we've gone through those 2 weeks and they make the embryos, kind of what does the next timeline look like?
So yeah, it's really fairly quick in terms of creating embryos. It's a few weeks to plan it. It ends up being the equivalent of about a cycle to get the embryos created, frozen. And then if we're doing genetic testing on embryos, which I think we're going to cover in a little bit, all the different kinds of testing we can do on embryos, it takes usually a couple weeks to get the results back on that. And then you actually have like all of the information on the embryos you can save for later. And then I think the bigger part of the process, because that part's relatively quick and can be done within a few months, is getting through the next big phase of the process, which is finding, if you don't yet have an agency, working with an agency, and then finding a gestational carrier that you want to work with, moving forward into that part of the process. And it really can be variable how long, and maybe you could even speak to this a little more, but how quick does it, how long does it take to find a surrogate?
I mean, surrogacy kind of depends on everybody's preferences on how they expect their journey to go, just communication wise, medical wise, and then labor and delivery. And so just personal preference usually is what makes those matches kind of happen. So it's like a date, but for a baby. So those can go relatively quickly, but then, there's the medical screening process that they do in the office for the gestational carriers. They'll also do a water ultrasound as well as a physical and things like that. And then usually it goes about the same. It's about one cycle once everything is cleared for transfer when you start your hormones. So probably the longest process that I've seen is just like finding your surrogate and having them approved. But I'm surprised that you got the embryo making goes so fast too. And I'm like,
the embryo
it goes so very fast.
It's so true. It's like embryo creation is quick, and then there's sort of this, I would say, longer part of the process, finding the gestational carrier, getting them through medical clearance can take, a month or two, getting through the legal part of the process, the contracts and everything ready. And then once you get all of that buttoned up, then prepping for the embryo transfer. Again, it's like it's all this waiting, and then it's like, oh my gosh, it's really fast. And it takes about 3 to 4 weeks. They'll be ready to go, usually waiting for the legal to wrap up, and then we'll get them on about 3 to 4 weeks. It's actually much easier hormones. It's usually oral medication to start, much less intense as far as the monitoring that we need to do. A couple ultrasounds, a few blood draws over about 3 to 4 weeks, and then a lot of our gestational carriers, actually the majority of them, are coming from out of state. So they'll come in once for that initial medical clearance. Everything else is done at their local clinic in their home state, making it a way easier for them to do all of that. And then they'll fly in a second time, usually for 2 to 3 days, coming in the day before so they can take it easy, get a good night's sleep, be away from their kids.
Rest, relax.
They sing in the morning.
Princess days is what we call them.
Exactly. We love the princess days. So they'll come in.
That's my favorite.
Embryo transfer, and it's like so fast, but so magical on the day of the embryo transfer. And then, they'll stay for like a day or two just to chill and take advantage of the princess days, which is just like self-care for a day or two before they have to go back into the chaos of parenthood.
Oh yeah. Oh, I was surprised how fast it went. And they're like, okay, and now we're in. And I loved watching it on the screen for my transfer. And then all of a sudden they're like, hey, you're gonna lay down for 10 minutes. And I was like, that was it.
That was it.
That was so fast.
Like 1 second, you're done.
But it was so cool to watch it. I'm not even gonna lie. I still have my videos saved.
Yes. Love the videos. Yes. We tell everybody to take videos or try and FaceTime with their intended parents if they're not here, so they can see, even though it goes so fast, it's so cool because you'll see like the embryo under the microscope on the monitor on the wall.
Oh yeah.
And then you see everything because it's done under abdominal ultrasound. So
and then you see your quick little white flashes, and then you're like, and there's baby.
Yeah, exactly.
I love it. So cool. It was so much fun. I love to show my friends. I'm like, you want to see? You want to see my surrogacy? I loved it. So what's the typical number of embryos transferred in a cycle, and what factors can guide that decision? Some intended parents new to the process have asked about transferring 2 or more embryos at a time.
Definitely one of the most common conversations that I have to have every day. And we used to have, for context, these pictures. I don't know if you remember them on the wall at checkout years ago. They're actually not there anymore. From, a lot of these pictures were people that were having babies like 10, 15 years ago from the earlier years of our practice. And there were like twin babies all over these baby walls. Like our success stories from fertility treatments and IVF. And I mean, they were so cute, but it was really misleading because things have changed so much over the last decade or so of how we do embryo transfers. And a lot of that relates to changes in technology, improvements in the lab, culture conditions. We've gotten so much better at growing embryos all the way out to that day 5, day 6 stage in what we call the blastocyst stage, being able to freeze them, do genetic testing on them, get all this information. So we don't do as many, what we used to do a lot more fresh transfers actually, where we would transfer embryos even right after the egg retrieval. We almost always freeze the embryos, transfer them later. And all of these new technologies in the lab have really changed the way that we do it. And success rates have crept up quite a bit over the last like 5 to 10 years, to the point where now we have very similar success rates with single embryo transfer compared to double embryo transfers. So I would say these days, and for the last like 5-6 years, about 95% of our patients are doing single embryo transfers and still maintain very high success. There may be some exceptions here and there that come up, you know, depending on certain criteria. We're trying to follow guidelines, and sometimes there can be issues with egg or embryo quality factors and different parameters. And with a lot of counseling, we'll sometimes make exceptions, but the vast majority of our transfers these days are single embryos, because we still can see twins even when we transfer a single embryo. Rarely, it doesn't happen often, but about 4% of our single embryo transfers actually can end up with embryos that split and result in twins, even though we've only transferred one. So sometimes you even get more than you bargained for.
Oh, yeah.
And with 2 embryos being transferred, it's a much higher chance of twins, which a lot of people love the idea of it, but they are definitely significantly higher risk pregnancies. So we're really shooting for like 1 healthy pregnancy and 1 healthy baby at a time.
And especially with that testing, to have those better quality of knowledge of how that embryo is going to develop and work. I mean, I can definitely see how it would be more keen to do one now, because you can see the success with it and the genetics going forward, where years ago it wasn't as great. So that's interesting to see the development in technology over the years. That it's like, here's where we've come and gone, and we still have great success rates because of this.
Right.
That's awesome.
Right. And exactly. And so the genetic testing has definitely revolutionized how we think about just the whole IVF cycle. And particularly for, you know, individuals or couples where they may only have, you know, because sometimes, you know, it's not a perfect science and biology can be complicated. And sometimes somebody may only have 2 or 3 genetically healthy embryos to even have for transfer. And, you know, you'd rather have more shots at 65% chance than like 1 shot at a little bit higher percent chance. So it overall cumulatively ends up being much higher success if you transfer 1 at a time.
Oh, that's awesome. And then what are some of the ways intended parents can stay involved or connected during their medical process?
Yeah, I think that's it is a really good point, because depending on how people are coming to this journey of surrogacy, especially for like our heterosexual couples, where, you know, maybe have a female partner who is very emotionally, you know, kind of gone through a lot of trauma and maybe really wanted to carry a pregnancy themselves and has, you know, unexpectedly not been able to carry a pregnancy. It can be emotionally, I think, really difficult for them to transition to using a gestational carrier, you know, so especially in that situation. But really for all of our intended parents, we want them to be very engaged and involved in every step of the process. Obviously, if, you know, it's a female partner going through the process of IVF, they're very involved in that part of the process. But then once we get through the transition to moving into the frozen embryo transfer with the surrogate, they're always involved with every step of the process. And we have amazing nurse team and coordinators that anytime anything is being planned with their surrogate, and then of course into the process of treating that gestational carrier, like we're communicating with the intended parents, making sure we know, do they want to be called, emailed, text message, or whatever the case may be. Sometimes if they're international, we're using all different creative ways of getting in touch with our intended parents, but we are always keeping them completely in the loop and treating them, you know, the gestational carriers and the intended parents really all the same, and just making sure everyone understands everything that's happening throughout that entire process for their treatment.
Oh, that's great. It's always, especially when they're international. It's kind of, you know, it's kind of a little difficult with the time zone change between to have those updates along the lines with them from both their clinic and their surrogate. That's always nice just to have that extra line of communication.
Yeah, and we do also have employees, actually, Utah Fertility Center employees that are like our representatives in different countries. And so we have many people that are working in Europe, and really overseas all over the place. So that way, like, no one's ever getting confused and calling people in the middle of the night. And so if we know in certain intended parents or a certain region of the world, like we have connections in all parts of the world, so we can connect with them at the same time zone, make sure there's no language barriers. So we have lots of opportunities to make this really as like easy and connected as possible.
Oh, that's nice.
Yeah.
That's always nice. I like that. And then what kind of medical screenings do surrogates go through before being approved?
It is a process where you alluded to earlier. So once they go through the initial record review, and there's certain very basic criteria, of course, that we're looking for a gestational carrier, right? They need to be medically healthy, have had at least one healthy pregnancy and delivery, psychologically stable, BMI not too high, age is a factor. So there's certain basic things we're looking for with like a record review that the agency will look at. We will again look at with the records. If they meet that basic criteria, then the next step is to have them actually travel in, because most of them are not in Utah. And so they'll travel in one day. We do another history, make sure we're filling in the gaps with any of their history that we need to look into more. And then we do a really thorough physical examination, including, as you mentioned earlier, an ultrasound. It's a special kind of ultrasound.
Special type of ultrasound.
Not the most fun. Not as fun as an OB ultrasound.
No.
But it is important. It's not terribly painful, but it's called a saline ultrasound or a saline sonogram. And we put a little bit of saline inside the uterus so we can open it up inside just enough so we can look at not only, the muscle health of the uterus, but the inner uterine lining to make sure there's nothing irregular or any problems inside. Because after all, embryos are microscopic. And, if there's anything irregular inside the uterus, even if it's really small, the embryo is confused, right? Because there's somebody else already in there. So
what is that?
Who are you?
This was my reservation.
So we're always trying to ensure that everything is perfect with the uterus, in particular, in addition to hormone testing and all of that. And to some extent, from the medical screening, the ultrasound, physical exam, the blood work is like the main part of it that we do. But a branch from the medical screening, as you also mentioned earlier a little bit, is the psychological evaluations. They also have, as part of and towards the end of the medical clearance process, a very thorough psychological evaluation to make sure not only are they medically healthy, but also psychologically very stable and understanding all the implications of what it means to be carrying a pregnancy really for somebody else.
Yeah, it's definitely that was probably one of the longest psychological evaluations I think I probably could have ever thought of when they go through it, because they want to make sure that you're very detailed and thorough, because pregnancy in general is very taxing on you,
right,
mentally and physically, but then you're adding in that it's not yours. So there's a lot more steps to go through the process, and to like have them just kind of talk about it and talk about coping skills and things like that have always been, they were great in kind of like preparing you for it and making sure that it really works well for you. So definitely mentally healthy side of things as well as physically healthy are big key factors for sure.
A lot more than you would ever have to go through if you were just conceiving naturally on your own.
Oh, absolutely.
So
great. And you did talk about this on the intended parent side, but how do you guys support your surrogates throughout the process while they're with you before being released to their OB clinic?
Yeah, so we will watch them really carefully. It is, as we've talked about already a little, it's biology. It is sometimes, very smooth throughout the whole process. Sometimes there's bumps in the road. So I think one of the most important things that we always try and emphasize to all of our staff, and particularly like our third-party team helping our surrogates in particular, is just like they are our patients, and we want to care for them just like we would for any of other patients, whether they're like our traditional infertility patients, our intended parents, individuals, whatever the case may be. Like all of these people that we're treating are our patients, and we want to make sure that we're treating them with like love and kindness and compassion, just like anybody else that's coming through our office and being treated. And it is a little bit more challenging sometimes because a lot of our surrogates are not in Utah. Some of them we can see locally, which makes it a little easier. But even if they're in a different state, like we're always trying to keep them in the loop of what's going on. Our coordinators are, I think, really good at making sure they feel very connected with the process. And also, like, when there are bumps in the road, encouraging them that it's not their fault and that, these things happen and it is not a perfect science. And just trying to give them encouragement throughout the process when things are not as smooth as sometimes we'd hope that they would be. And, just treating them like the gifts that they are, really, because they're doing something that's like really special for other individuals or couples that need their help. So we really try and like take really very especially good care of them throughout the entire process.
Yes. And I can personally attest your guys' as coordinators are fantastic.
That is great.
There were several emails where I was like, I feel so bad. And they're like, don't.
Yeah.
This is not your fault.
Good.
Like my lining. Let's talk about it.
Yeah.
Oh, it does. So do you find any trends or common traits among successful surrogacy journeys? I kind of know a big thing, like the joke of surrogates is the sticky pineapple socks or shirts or McDonald's fries after your transfer. I mean, do you guys see any of those types of trends or things that maybe you've had?
I wish. You have lucky socks. We have lucky socks. Yeah. We have. I think it's all about the lucky socks. They're Utah Fertility Center, beautiful lucky socks, and they do have pineapples on them. And we tell everybody to go to In-N-Out Burger and all those things, but and get French fries. But no, I mean, I think at the end of the day, it is. I think about setting very realistic expectations at the very beginning of the process, both for the intended parents and the gestational carriers. So everybody understands, like, okay, this is the process, this is what you're going to be going through, this is the timeline that we're looking at, these are the expected success rates that we can see for these embryos with each embryo transfer that we're going to do. And sometimes it's really smooth, sometimes it doesn't work the first transfer, and this is just part of the process. I think if people go into this, I guess it depends on how you define successful journey, right? Yeah. It's like the experience that you have, I think, depends on what expectations you have for the process as you're going into it, right? So I think it's very important for us as the clinicians and the physicians and like the third party directors, kind of my role in the practice, making sure everybody that's moving into this understands what the process looks like with the timeline, steps involved, and expectations for success. So even if it doesn't work for the first embryo, we want it to work every single time, obviously. But in those situations where it doesn't, take with the first embryo transfer, just like knowing, okay, quickly following up, these are the things, these are other tests that we could do, and getting back into the process quickly without being you're obviously going to be emotionally distraught if it doesn't work, but just like knowing that can happen and moving forward into next steps as efficiently as possible. Yeah. Is helpful. And then I think, as far as success, it's all about that medical screening and being really thorough with all of the testing that we do leading up to creation of the embryos. And then with the surrogates, doing all of that really involved medical screening so that we're setting everybody up for success throughout the entire process moving forward.
Yeah, I think that's great. And then can you explain what PGT, the pre-implantation genetic testing is, and when is that usually typically recommended within the process?
Now that's a very, I could spend all day talking about that. So pre-implantation genetic testing is a lab technique. So once embryos are created and grown into that, they're, eggs fertilized with sperm grown to the blastocyst stage, where they're about 125, 150 cells with a little cavity in the middle. You can do a biopsy. So the embryologist will sometimes do a biopsy from the edge of each embryo right before freezing them. And you can tease out just a few cells from each embryo that makes it to that blastocyst stage and use the DNA from those cells to do all different kinds of genetic testing. The one that we utilize most frequently is called pre-implantation genetic testing with aneuploidy screening, which is basically testing to look for any errors that happen when the sperm and the egg's genetics combine, making an embryo. Some embryos can have mishaps in that process where the embryo can end up with an extra piece or a missing piece of a chromosome. Things that we hear about all the time are like Down syndrome, which is one of the few that can involve an extra piece of chromosome 21 called trisomy, which means 3 copies of chromosome 21 that is compatible with life. So it can sneak through the first trimester and grow into a baby. So that's Down syndrome. And it's similar conditions to that, but the vast majority of chromosomes are not compatible with life. So if you were to transfer an embryo because you did not do this genetic testing, and it was chromosomally abnormal, the majority of them our body actually recognized as abnormal. And so we're like designed to kind of select them out, right? If they're not going to be a healthy child by miscarrying real early, usually in the first trimester, or sometimes not even implanting at all. So there are certain circumstances, and it is very controversial in our specialty, who should be candidates to do screening on embryos. We do it for sure more often when we're transferring embryos. We know that the intent is transfer to a surrogate because I think people often have been through so much,
Yeah.
agony in the process of infertility in different situations, and they want to do anything they can to have extra diagnostic screening on the embryos and lower the risk of miscarriage as much as possible. So we certainly do it a lot in embryos that are intended to transfer to a surrogate when there's somebody else involved, many other people involved.
Yeah.
We do it often in older women doing IVF, particularly those over like the age of 37, 38, because our genetics and our eggs get stickier is how I think of it as we get older. So when our eggs merge with the sperm to create embryos, there's way more errors in the process and much higher ratios of genetically abnormal embryos in older women doing IVF.
Yeah.
So we do it in older women or couples where the female partner is older. In women or couples that have had like recurrent miscarriage, we definitely do it more frequently. So there's certain indications, those are probably the most common few.
Okay. Yeah, I always saw them, they're like, and these are tested. I'm like, I have no idea what that means.
I know.
But we'll take it.
Oh, but and you can see the gender.
And I can see the gender. I know what we're transferring.
Yeah, so a lot of our intended parents, I mean, they love to have the genetic testing and that extra peace of mind. In really young, either heterosexual couples and donor egg IVF, there's a big controversy that we could spend days talking about here in the United States with regard to whether it actually improves and really moves the needle in a significant way as far as pregnancy rates and live birth rates. But so many of our intended parents actually like to do it, not only because it does give them just extra information that they love to have, but they also can see that gender. Yep, and
I know waiting till that 20-week appointment was always rough.
And it's not 100% accurate.
It's not.
There are occasionally errors with the testing too, but
it's pretty close.
It is pretty close.
And I want blue.
Yes, exactly. Exactly.
I love it. So what are some options for intended parents that are using egg or sperm donors?
So they're a bit different, right? So for sperm donation, most of the time we use just donor sperm banks, and there's many of them around the country, and they go through the screening. The men that want to donate sperm go through a screening process. It's FDA approved, so they do lots of infectious disease testing. Sperm's quarantined after they do the testing. If the sperm looks good, they test negative for everything. They can freeze little vials, is what we call them, of sperm, and then those vials, after 6 months of quarantine, retesting for infectious disease, that looks good, then the sperm vials can be sold to individuals or couples all over the country or world. There are also agencies that do help with sperm donation, so you can use either an agency or a donor sperm bank. And both are great options, a little bit different, but lots of options to explore there. Sperm's, a little bit easier in the sense that you can just purchase like a sperm vial, and you only need one vial to go through the process of, say, an IVF cycle to create embryos, because you really don't need much sperm compared to the number of eggs you're going to retrieve. Even if it's a donor egg cycle, and you're talking 20, 30 eggs retrieved maybe, and you only need 20 to 30 sperm, and there's going to be millions of sperm per vial. So in general, you only need one sperm vial, which makes the process fairly straightforward. Eggs, of course, as women's bodies are so much more complicated in every way. They're a little bit more complex, and so there's lots of different ways to proceed into the donor egg option and look for an egg donor that meets your needs, that may be physical characteristics or education or athleticism or whatever it is you're looking for, so you can actually search and kind of select a donor that fits what you're looking for. And then once you choose that egg donor, they prospectively go through the process of IVF, where they're on those same injections we talked about earlier over the course of 10 or so days to retrieve their eggs. And usually you're getting 20, 30 eggs on average from an egg donor cycle to then fertilize and grow into embryos to eventually transfer to either an individual or a surrogate.
What's one piece of advice or encouragement you'd like to share with any intended parents beginning their journey?
I mean, I think just like the fact that you're listening to this takes a lot of courage. And it's a very overwhelming process. So the fact that you're here is already like many steps into the process, just to be here and listening and trying to get options and information. And I think like whether you're an individual moving into this process or thinking about it, or a couple, traditional same-sex gay couple, whatever the case may be, like try and give yourself some support. It's a stressful process. Find people that you can engage with and try and like take care of your body and take care of yourself, both mind and body, throughout the process. Do yoga, meditation, whatever works for you for stress reduction, because it is a journey and you want to just be able to like kind of appreciate yourself in this process and take a moment to like try and add stress reduction, because it can be kind of overwhelming and take over so many aspects of your life, but is so rewarding in the end. And like we're here, whatever you can do to kind of add stress reduction, support yourself with like other friends and family, say no if there's things that you don't want to do, like just take a pass. And you know, if it's like extra exercise throughout the week, or it's like sitting on the couch and eating ice cream here and there, just kind of like give yourself a pass sometimes, and self-care, but also know that like agencies that you connect with and fertility clinics and the providers like us here at Utah Fertility Center are just here to support you and help you throughout the process.
That's awesome. I think that was all of them. I think that's all of our questions.
I think that was it.
I think that was it. That went faster than I had imagined. I thought there was more, but that's perfect. But okay, I want to thank you so much for being with us here today. It was really great to chat with you and have all of your information. And, you know, I personally have worked with you guys before as a surrogate myself, and I've actually absolutely loved working with you guys. And I think it's great that you guys have grown so much over the years and really have like developed such a great practice here. And I think you guys do wonderful things as an IVF clinic, honestly, just helping the parents get their babies and working with them, and then helping them with surrogates if they have to go that route. I think it's fantastic for everything that you guys do. And I just want to thank you so much for that.
Thank you. I mean, I think we've grown so much, but we also, I think because we did start as such a small boutique practice, we've tried so hard to maintain like a very personal approach to every person, every individual that's coming through to see us. And we hope that we can just like, you know, kind of continue that boutique feel for all of our intended parents coming through the process. And it's so fun to like actually meet you in person.
I was so excited to come in because you guys honestly have been a fantastic clinic to work with prior, and I would absolutely recommend you hands down, personally from my experience. But I do know that there are other fantastic clinics out there across the United States, and I'm sure they've all have great care facilities and staff on board of them. But it's also great just to know that like I personally have worked with clinics that have worked fantastically, and you guys do like just the care that you guys give to your intended parents and to your surrogates is a really big thing. Because like you said, it can be a very stressful process. And just to have that extra support on all fronts is always great. But like everything that all the IVF clinics do for infertility around the country, you know, you guys are just phenomenal for really focusing in and helping grow that practice and build it out so much over the years to help successful transfers. Wow. That's just, you guys are rock stars.
Oh, thank you so much. Yeah, and I think it's true. Like I think that you bring up a good point as well for other people listening in different parts of the country or different parts of the world. Like there are lots of amazing fertility doctors and incredible fertility clinics with awesome success rates, but I do think that the third party reproduction aspect of fertility treatment can be very unique. So if you are looking for a clinic in a different part of the country, you know, it is, I think, important to ensure and ask questions and make sure that wherever you are seeking treatment, make sure that it is a practice. I think it does help to make it a smoother process if you're seeking treatment in a clinic that has a good amount of experience with specifically third-party reproduction, because it is a kind of a unique subset of fertility in general. And so it does add a little bit to the complexity of the treatment, and helpful if it's a clinic that has lots of experience with that part of fertility treatment.
Yeah. No, absolutely. And again, just because that support that you guys can give with it and to really know and build with it, and you guys have built out your practice with that, it's definitely nice to have that extra support with it.
Yes, it's been really fun to watch it grow.
It has. Well, thank you so much for joining me today. And thank you everybody for joining us. You guys are welcome to reach out to us through www.acrcglobal.com. You can also reach us at 949-418-8146. All of our consultations are complimentary, and we'd love to speak with you if you're interested in getting to start your process.